Do I have gum disease? Do I really need a deep cleaning? Hi, my name is Dr. William Park with Bless Smile and Smile on You Dentistry. You may have gone to the dentist and been told that you need a deep cleaning. What does this mean? And do you really need it? We'll be answering all these questions in this video. The medical term for a deep cleaning is scaling and root planing, or SRP. It is not just a better cleaning, and it is not something that everyone needs periodically. These are both very common misconceptions. So let's find out what it is and why you might need it. Whenever you go in for a routine dental checkup, x-rays and something called perio charting should be done. X-rays and perio charting will help the dental professional determine what kind of cleaning will be best for you. X-rays will help us to see if there's any buildup under your gum line and will help us to see if there's any bone loss going on. Perio charting is when they take measurements of your gums and surrounding tissues. We check how tightly or loosely your gums are adapted to around your teeth. We use this device called a perio probe. It has markings in millimeters, and this helps us to evaluate how far your gums have loosened around your teeth. And this will help us to evaluate if you have gum disease. So just to go over the basics of what gum disease is. So generally you have your tooth here and you have your gums around it, and underneath that you have your bone. The bone is what is holding your teeth in. As you start to get buildup around the tooth, the gums originally start to get a little puffy and red, and eventually it starts to loosen around the teeth. And this is what we call a pocket, and this is what we are measuring when we are doing the perio exam. And this is an area that is very hard for you to clean at home, and it's very hard for even me to clean at home in the dental office. When this happens, we can no longer do our basic dental cleaning, and we have to do something called a deep cleaning, which involves numbing the area to make you comfortable as we clean all the debris that is under the gum line. So this is what a scaling and root planing or deep cleaning is. It is not a surgery, it is a deeper cleaning. Generally, this will be done in 2 visits. 1 visit for the left side and 1 visit for the right side, so that we don't have to numb up your whole mouth. After the scaling and root planing, we generally like to see you in a few weeks just so that we can reevaluate how your gums have healed and to see if there's any improvement. If everything is looking great at your follow-up visit, we will continue to see you every 3 months rather than the normal 6 months for routine checkups. This is just to make sure that everything is back into a normal and healthy state. I just want to make it clear that if you do not get rid of this subgingival tartar or buildup under the gum line, it will not go away. This tartar or calculus is an infection going on underneath your gums. It's holding a lot of bacteria. As we talked about, your bone is what's underneath your gums. Without proper treatment, this gum disease will continue to eat away at your bone, resulting in more and more bone loss over time. Like we talked about, the bone is what is holding your teeth in. So if we start to lose bone, your teeth can start to get wiggly, and if it gets to a certain extent, this is how people lose their teeth. So how does this happen? It can be a long-term effect. Maybe you haven't gone to the dentist in many years and you've had this building up under your gum line for a long time. Or maybe you do go in for your 6-month checkups and cleanings, but you don't really floss every day and maybe you're just prone to more gum disease. It's impossible for me to describe every single reason for every case, as there are countless variations on why this may happen. But if you've been noticing that you have bad breath or your gums are a little sore when you floss or brush, you may want to go see your dentist because that may be a sign of gum disease. If you have any questions about what we just talked about today, please DM me on Instagram or you can leave a comment on this video. So I hope that I answered all your questions about what is a deep cleaning and why you might need it. As always, I appreciate you for following along. Make sure you're following me on Instagram and make sure to subscribe. Thank you for watching and hope you have a great day.